Good afternoon, everybody. Welcome back to Build. My name is Elena Shepard. We are here this afternoon with world-renowned plastic surgeons Dr. Terry Dubrow and Dr. Paul Nassif. Tonight is the mid-season premiere of season 4 of Botched, and we are thrilled to talk to both doctors about all things plastic surgery and TV and this show, which I'm obsessed with. But before we welcome the doctors to the stage, let's take a look at a clip from Botched.
Let's look at the left one first. Thin skin, little bit of rippling, and the nipples going down. The treatment for that is to lower the pocket a little bit, that allow the nipple to come up, and put a silicone implant in. All right, so let's look at this one. This one is classic encapsulation, which is very significant. There are 4 grades. Grade 1 means soft, essentially no encapsulation. Grade 4 means super firm, painful, and displaced.
That's
you have
me.
grade 4. But you're so thin, despite the encapsulation, you can feel the implant. So if we take the scar tissue out, you're gonna have paper-thin tissue on top of an implant, and it could be very irregular and ripply and not look very good either. So this is a quagmire. I have to find the right balance between manipulating her scar tissue to relieve her of her symptoms, but leaving her enough soft tissue so that her breast is aesthetically pleasing. We can do this if you want, but there's no guarantees that it's going to work.
It's very scary when you don't know. Will it happen again? Will I be in pain again? But I honestly have such faith in Dr. Dubrow. I feel great about it. I feel really great. It sounds right to me.
It sounds right.
Yeah,
It feels right,
It feels
right?
right. I'm ready. I'm ready.
Welcome to the stage, doctors.
Thank you. I mean, did you notice, as usual, that I wasn't talking? They didn't allow me to talk because this guy talks, for me. I know. Here's what he's going to say. Well, usually when I watch the show, I fast forward him, and he has a high-pitched voice because it's very fast, and you pretty much ignore me all the time. You do ignore me.
I've already had a root canal, so I'm not going to answer
See,
that.
you just don't care.
I was going to say, Dr. Nassif, you didn't get enough of your voice in there in that moment.
I don't know what happened. But what does happen, though, I will tell you. I'm going to tell you something, and you cannot document this. In those kind of things, I'll be sitting like this, right? I'll be standing there like this, and he's talking and talking.
And he's falling asleep.
I fall asleep.
He literally does.
Asleep.
Right.
Or I'll sit there and start dazing, because just his voice is very soothing to me.
Oh,
It makes me want to sleep.
good to know.
Well, congratulations. We're here coming back in the middle of season 4. Very exciting.
This is what, season 5 now?
I believe you're mid-season 4?
Mid-season
Call it
4.
that?
Yeah, it's really our 5th season, but
Okay.
okay.
Technicalities.
Yes.
How does it feel to be where you are now? Could you have imagined this day 1 of shooting?
The interesting thing, I don't know, just about the story real quick, I got to give this part. So right after I finished The Housewives of Beverly Hills, which don't really want to talk about that much. Obviously, I'm divorced now. But we were having dinner with the producers, and we were sitting at a restaurant in L.A., and we were talking about doing something. And I go, maybe a great idea, and one of the producers thought of this also, let's take very complicated cases, just like what you saw here, and try to fix them, I use the word try to fix them on TV. And make it, heartfelt, we're helping people. And so, obviously, we need, somebody, because I only do the face, and Terry does everything. So I called them, plus we've been friends for a long time, plus they knew him because he's on the Housewives of Orange County. I called him, and he said to me,
That's an incredibly bad idea. Because if you think about it, we're going to take cases of impossible to fix plastic surgery that's extraordinarily high risk and try to fix them for their 14th, 15th time on national television. So, I mean, it's too high risk, it's crazy, it predictably can go very wrong, and could be risky for both the patient and us, right? So I thought it was a bad idea.
How'd you convince him?
It didn't really take, I think he had the flu at that time, so he was lying in bed and he just didn't feel well. Then I think after a day or two later, he said, okay, let's do this. And the interesting thing, but here's the coolest thing, is you do something called a sizzle reel. A sizzle reel is, you want to kind of give, a little filming of us, maybe doing something for the show. But the funny thing is, all we did is we did a scissor reel sitting in my office talking for about 5 or 6 minutes. And it got picked up by E, not to do a pilot, but to do the whole show based on just the two of us talking. And plus our chemistry.
You do have great chemistry. How did you guys first meet each other?
He came in for a consult, and I said, I'm good, but I'm not that good. No, I met Paul through your mom.
My mom and my sister.
Yeah.
And that's how I was doing my fellowship, I think, in St. Louis. And my mom called me, my sister. We met this incredible doctor. I think my sister was coming into, little something by him. And, because he is funny, he is very, he's got a great personality, very funny, and they loved him. And then it's interesting, then when he came back to LA, we went on double dates together with our ex-current wives. And he came to my office to practice a little bit in LA when he was there, and we've been friends for 19 years.
That's incredible. What were your first impressions of each other?
Honestly, I thought he is and was and still is obviously a very sweet guy, a very honest guy.
Wow.
A guy with a guy with a very intact ego, and clearly a very skilled surgeon. And that's why I think Botched works, because we have a natural long-term relationship, a friendship that allows us to sort of feed off each other's abilities and support system. And I mean, I don't know if you've ever seen the noses this guy does. Nobody in the world can do them like him, and they're impossible to fix. And even on the show, I say to him behind the scenes, yeah, I don't think so, Paul. This one's going to die. This nose is going to literally fall off. I think you should probably pass. And because of the Botched experience, which we call it the Botched experience, which means we've been given this opportunity to do the hardest surgery at the highest volume that any two surgeons have ever had in history, and that's why we've been able to fix these problems that we couldn't have even fixed before, but now we have this unique skill set.
Did anyone record this so I can get a copy of this? Those nice, beautiful things that he said about me. Also, it's part of that, and when you watch the show, and by the way, this isn't scripted, or they don't tell us what to say, so everything that happens on, especially the bromance that we have, it just flows and it's natural. And I will tell you, though, we'll be sitting filming, and he does come up with the best one-liners I've ever heard. The spontaneity is incredible. It's perfect timing. And we'll sit and we'll probably laugh for about 5 minutes. They'll have to stop filming. We'll just sit and laugh. We can't stop.
Yeah.
Yeah, I mean, your bromance is it's built on so much, poking and go-atting and all that stuff. But when I watch the show, I feel like you couldn't do this job with someone you didn't trust as much as I imagine you guys trust each other. Like,
I mean, yeah, for this, for example, I'll add one part. Skill, got to have the skill. You also have to be able to, do this. You have to have that friendship. But more importantly, you got to like each other.
Yeah.
Because to do this, and listen, we're going to get into it, and we're going to argue about something. We've been together for such a long time. But you got to be able to be like brothers. You got to be able to deal with it, go, move, and have fun, and like each other.
Yeah, at the end of the day, I think it's really important to understand this is really dangerous plastic surgery that we do. And it's extraordinarily high risk. And I will tell you, the complication rate associated with first-time plastic surgery is about 5%. The complication rate associated with revisional plastic surgery, garden variety, is 20%. The general complication rate with high risk that we do is probably 40 to 50% chance that we will make it worse. Not we, but that it would be made worse. So this is incredibly high risk, and by high risk I mean the nose can fall off, the breast can die, the buttock can necrose. I mean, the worst things you've ever seen. So now that we're in what we call our 5th season, what was formerly impossible is now pretty routine, but unfortunately, the plastic surgery complications in this country and all over the world have gone through the roof. You would think the opposite would be true because of Botched, right? Because of the cautionary tale that Botched tells, it's gone the other direction.
Why do you think that is?
We have our theories. Number one, we think there's this phenomenon we call Snapchat dysmorphia, where patients filter themselves on Snapchat or Instagram, and they have an idealized version of what they want to look like. So they realize they don't look like this, and they start to get anxiety over it, and they go into their plastic surgeon's office in high rates now and say, I need to look like this. So there's a lot more plastic surgery happening, and people are still pushing the envelope, particularly in one area, buttock augmentation, where they take fat from one area, inject it into the buttock, and it turns out to be the fastest growing procedure, and it's actually potentially extraordinarily dangerous.
That's the fastest growing procedure?
Yes.
And I mean, I know that there are all sorts of terrible things that people do to their bodies, injecting even things like cement, right?
Silicone, adulterated silicone, concrete, caulking material from plumbing supply stores. It's still going on. Cardi B just admitted to doing this to her buttock a few years ago. I mean, Cardi B, this is not someone who needs to go to a discount pumping party in somebody's living room, but people are still doing it.
That honestly just blows my mind. I can't even begin to imagine that. One thing that, as a viewer, I lose sight of, probably because I'm not a doctor, but you are, as you said, doing very high-risk surgeries. People's lives are in your hands. You're cutting them open. What is the television aspect of that like? Do you worry about cameras, or was that concerning to you? Is that something you even think about anymore?
You know, when we did this, put Botched together, the goal was to show everything. We wanted to show the audience, since it's a cautionary tale, of what happens wrong inside the operating room. So we don't think about the cameras. We pretty much forget about them. And we want to show the complications, so we really don't worry about those things. And they do follow us along everywhere inside the operating room. And that's why when you see the show, especially this year, you're going to see us both have complications. But we tell the patient. For example, I tell a patient I did the 15th, 1-5, rhinoplasty on someone. Now remember, the skin, it only has so much blood supply. And she already was high risk, and I said, you have a greater than 60% chance of having some nasal tip necrosis. That means the skin turns black and dies. But hopefully we can control it and contain it. And she did, but not as bad. And overall, was she made a lot better? Yes. But we show all that. So we want to show that, hey, this is real plastic surgery, and make sure that you understand what you're getting yourself into.
Yeah, it's interesting what you mentioned about social media, and then just adding in, I think people forget that plastic surgery is surgery and is a big deal.
You know, we also feel that plastic surgeons are partly to blame for the complications, and I'll tell you why. If you look at plastic surgeons' Instagrams and social media, it's all pictures of their family and their kids going to summer camp, and mixed with before and afters that are perfect. And that,
I'm guilty of that, by the way.
well, your befores are disasters, okay? Your
Befores. No, we
the
said
befores. So
I don't do little easy ones.
But you know, celebrities that promote products on Instagram are now required to put hashtag ads so that they're not fraudulently telling people that they use this product when they're in fact being paid for it. But plastic surgeons, we feel, glamorize by putting beautiful before and afters mixed with their kids in there. And we feel that plastic surgeons should have to put a warning label on before and after. Just like a drug company has to put a warning label as to the side effects after a commercial, we feel we are responsible for making plastic surgery seem like it's having your hair and nails done and it's no big deal. So it's really unfortunate, but I don't think we as a society get across the fact that this is plastic surgery. It's like cardiac surgery. It's like cancer surgery. You can die from it. And by the way, people do. You can go blind from it. People do. Terrible things can happen. And you should think very carefully before having this procedure done. Make sure you really want to do that before you take on the risks.
What about procedures that, you know, I even hear my friends talking about now as like not a big deal, like fillers or things like that? Are those a big deal?
So I lecture about fillers. I have a lecture called Complications in the Face Fillers. And what he just mentioned about blindness, it's not too uncommon. When you inject in certain areas, temple, right here in the cheek area, or in between right through here. So these things could happen. In addition, necrosis, losing the tip skin, bad infections. Now, it can happen with experienced physicians. However, the most important thing that we give advice on is, one, be careful, know the anatomy, know knowledge, but again, you have to make sure you go into what we call an experienced injector. But so everything that happens that we do, there's nothing, even the little non-invasive radio frequency to tighten up skin, complications can occur. And again, we don't want to make this whole thing a bummer and a downer. That's what it sounds like about. But we're talking about the serious aspects, so as long as everyone's educated.
Yeah, it's important to understand the words non-invasive. We plastic surgeons like to say that because it sounds like it's not scary or not risky. Non-invasive procedures can lead to blindness. Non-invasive procedures can lead to your entire cheek turning black on you. So it's just important to understand, go to someone who's very experienced and still know, even in their hands or our hands, these things can happen.
I mean, yeah, this is all really good to know. I feel
We need something upbeat now.
well. We were going to take a look at some pictures. We're hoping you could talk us through these. I don't know if it'll be upbeat or not, but
Okay. We just were on the Megyn Kelly show this morning with Carissa. And this young lady got bit, actually was at a friend's house, went down, apparently the dog was acting a little aggressive, went down to pick up her phone. And when she picked up the phone, the dog went and grabbed her lip, and then she passed out. She woke up, and a big piece, this chunk was gone. And so what the doctor did, maybe not the best thing to do at this point, but he took the lower lip and went like that. See right up to here? Mm-hmm. Right up to there? That's all lower lip. So he kind of just made it into a circle. Functionally, couldn't eat a hamburger. Her life was destroyed. She didn't want to leave the house because of this, scars and this lip. So it devastated her life. Luckily, and a lot of times we'll go in a procedure of not knowing exactly what to do. We have a plan, but we don't know if the tissue is going to really react and let us do things. So I did 2 procedures. I tried to establish getting the lip back. And so I got about most of the lower lip back, about 3/4 of it that was used, and elongated the upper stuff, the muscle, stretched it, and did the scar, and we did 2 procedures. And we were on today, I said, the first question, I said, well, have you eaten a hamburger? Not the gigantic one, slider, McDonald's cheeseburger, something like that. And she said, yes. So now her life has been changed, and that's what we're lucky to do that. So one, we're doing, as surgeons, we want to do cool, great stuff that we can learn, which we do. But when you make a change like this in someone's life, that makes you feel good. It really does.
she must be so happy.
She is.
I think we have one more picture to show as well.
So there are several reasons why a patient can end up what is called botched, okay? One of the most common reasons is obviously a plastic surgeon sort of botches them, technically makes an error. And this is a classic example where a patient who had a very small breast and a short distance between the nipple and the crease where the breast meets the chest, he dissected way too far down and caused the breast implant to be what's called bottomed out. And
That's
so,
the implant, right?
And so this, if you look at a lot of textbooks in plastic surgery, this is considered not very fixable. But I'll be honest with you, after doing 5 seasons of Botched, I can do this in an hour. And not because I'm so special. Well, maybe I'm a little special. but it's because I've done this so many times because we see this complication so often that I can fix this quite easily now. But this is a really, really difficult case. But it's also important to understand the #1 procedure in plastic surgery is breast implants. Most of the complications of breast implants are not at all related to what the surgeon did. It's related to how the patient's responding immunologically to the implants, forming scar tissue. So there's many reasons that patients can have a botched result.
She must be thrilled as well. I mean,
Yeah, she had a very serious endometriosis, which caused her a lot of pain and inhibited her ability to be romantic and so on. So she wanted to do something to make herself feel better about herself, and then she ends up with endometriosis and then this result. This is obviously a disaster. But now she's in a much better place, and
she's dating.
And she's dating.
That's great to hear.
Yeah.
Before we take it to audience questions, I know we have a few. I just wanted to end on a high note, like you said, and ask, what surgeries stick out as ones that you're most proud of or made you feel the best?
Well, I have my Lucy DiPrima story from season, I think, 3, and this is my story that I always remember. A young lady was in Italy driving a moped, hit a wall, destroyed her face, nose. Went to some very good doctors to fix it. Result wasn't great. And she has an autistic daughter, but the appearance of her nose prevented her from doing things with her autistic daughter, going to the park, things like that. And she just couldn't get herself to leave the house. Came to us, we examined her. She had clear fluid leaking out of one of her nostrils. Now remember, she had trauma to this area. So we say, could that be fluid from the brain, called the Csf Leak? So we got a CT scan just to check, make sure. What came back, she had 3 aneurysms in her brain. Those are little blood vessels with these little round things that's dilated and it can pop. When it pops, you're dead. You die just like that. I lost my cousin to that in Boston, as a matter of fact, just didn't wake up. So we found these, sent her to an incredible doctor at Harvard. He fixed them. She came back, did her nose, and then the final story, which made it all worth it, is they have what we call a reveal, when they film the end, of something. And I showed up, which is rare for me to go to these reveals, and the daughter was there. And she made me a little sign, said, Dr. Nassif for president, and she was severely autistic. And she was, my mom now is able to, go with me, and thank you so much. And that just, I fell apart. I had to walk off for like 15 minutes. I'm on the side. I couldn't help it. I couldn't help it. I started crying. I've cried a lot on the show, by the way.
Yeah.
And so that was my thing that, we saved a life.
Mm-hmm.
In my, just very quickly, because that was very long.
But you had to ruin that. See, I just gave a beautiful story and just had to ruin that.
In season 1 or 2, we had a patient we turned down named Raji who had cement injected into her face. We turned her down just like 10 other plastic surgeons did because it was too dangerous to try to go ahead and tackle this. She had sort of this elephant man look. But the next season, we had been thinking about it for about 12 months, and we said, you know what? We have a plan. And we brought her back, and we actually tackled her, very dangerous surgery, and it worked. And she looked normal. And then we said, but you can reactivate these nodular immunologic reactions over time. And then a couple seasons later, she called us, and some of them came back. And when they come back again, it's even more dangerous. This season on Botched, we bring her back to the operating room, open up her face again, and try to relieve her of these giant masses. And it's a lot more complicated this season and a lot scarier. I'm very proud of that.
I have to add something to this. When we first saw this patient, she looked pretty scary to us. I mean, we were taken back at her appearance. And just think how all of you would have felt looking at this woman. But the interesting thing, we fell in love with her personality because she was so sweet. And you know what she goes? She empowers women about, look what happened to me, but I still do this, this, and this. And so she was the sweetest, one of the sweetest souls that we met. And then with this surgery, to get her back and wait till you see her, what an incredible transformation. It's like, what can I do? And when you do this to somebody, especially a wonderful woman who is like now a monster, when she walks down the street, everyone just stops and goes. And to fix her and help her get her life back to normal, that is so incredible,
Thank you so much. I know your audience has questions for you. Go ahead.
Hi. Thank you for doing the show. Again, like you said, the cautionary tale is very interesting to watch. And you talked about the Snapchat effect of things. How, to that end, do you think that men are falling into pitfalls because of that? I mean, obviously the show sometimes focuses on the different types of procedures for women, but also men. Cosmetically, what type of procedures are men getting botched at a higher rate than maybe women are?
Well, I think, first of all, about 10% of my practice is men, okay? And men are having a lot more cosmetic surgery, but they're not willing to admit to it like women, so it has to be sort of on the down low. But they are still having complications all over the place. And one of the common ones, men like to do a lot of sort of body surgery as well as fillers. And there are tummy tucks, and men are doing fat transfers to the buttock, surprisingly enough. And we're seeing a lot of complications related to body surgery, particularly the abdominal area and the buttock area in men, which is unexpected.
You know, I do, obviously, as the face, and I primarily do revision noses. I have not seen an uptick, increase of revision noses in men. I mean, I do about 20 to 25% of my practice is male plastic surgery of the face, especially the nose. So I don't think that has been a big issue because, for example, us, I mean, when we do TV, for example, we don't even want makeup on, even though today they made us put makeup on earlier. So we have it on now. And we don't filter our stuff at all. So, you know, most guys in general just take a photo and that's it.
By the way, you should
Click
start
comment.
filtering your Instagram photos.
I look good, baby. Because I'm a lot better looking than you.
You should filter.
Next question.
Filter.
We have one more question, yeah.
Hi guys. Since this show's been on for so long, do you feel the pressure of taking the risk a little bit higher, and you're just like, but like, do you still feel that pressure even now, even though you guys have been building your skills since the show started?
It's interesting you asked that. We don't feel the pressure because we take what comes. Now, you're right in that every year the cases get more extreme. In the first couple of seasons, the super extreme cases we would have passed on, but now that those have become sort of more routine, we're naturally applying this new skill set to even harder cases. So cases that we passed on earlier, we start taking in these later seasons. And that's why this was an extraordinarily difficult season because the cases were hard. We had complications. Some of them had to have multiple surgeries. But one thing I love about this show, besides teasing him all the time, which is so fun, is it's really a positive show in that we're very happy to show the complications associated with plastic surgery. We're very happy to send the message to be careful. Plastic surgery is great when done properly for the right reasons. But at the end of the day, we're doing something that's incredibly positive. So there is a traffic accident component to the show, but there's a real happiness surrounding the entire show. And if Botched were a color, it would be light blue or something, like a sunny day.
We have one final audience question.
Hi. I was just wondering, has any of your patients felt like uncomfortable being on camera when you guys were doing the show?
Well, remember, I'll give you the medium answer to this. When we first did this, we had 800 patients, I think, get casted or applied to Botched, and they already knew they were going to be on TV. Season 5, we had 10,000 apply for this, and internationally, too. So that means the people are coming out more and more. They know they're going to be on TV, and we have not seen yet, maybe at least my patients, any issues because that's what they're getting themselves into. They're coming on to be on Botched. If they want to go to our office directly, which obviously we have our own private practices, they can do that without being on TV.
Right, I see patients in my office with disastrous complications they open up their gown and I say, you should apply to Botched. And because I'd like to be able to offer them the Botched experience is a really great experience for the patients. We envelop them in the producers, we take care of them, we fly them out. It's the best medical care on the planet. But they say, I don't want to go on television. And so, they sometimes don't have the opportunity because they just don't want to show their story on TV. But obviously, just what Paul said is that if they come on Botched, they know they're going to show everything. And they're happy to do it.
Doctors, thank you so much for joining us. And new episodes of Botched begin this week. So check it out. Thank you.
Thanks for having us.